I'd like to welcome Ross Tibbles. Ross is the service improvement nurse from Guy's and St Thomas's and has been working with shared and self-care for over 15 years, so long before the momentum started to gather more recently, and in fact was one of the first to identify the approach that's been reused in many other locations. And Guy's participated in Wave 2. So welcome, Ross, and thank you for joining us.
Thank you very much. So our journey started around 15 years ago, and it was part of the modernisation initiative, which was a 3-year improvement programme across the whole of the kidney patient pathway. And at that point, we badged it self-care, so forgive me if I swap between the two terminologies. So around 15 years ago, our aims were for our patients to reach their maximum self-care potential, and we anticipated that around 10% of our patients could become fully independent across all of our dialysis units. We wanted to support staff to establish their own strategies because we acknowledged that one size wouldn't fit all. We did want to increase take-up of home dialysis, although we already had a thriving home haemodialysis programme. We wanted to increase the access to home dialysis because we knew from patient experience that for a lot of patients it's a really great option. And the most challenging part, I think, was to ensure long-term sustainability, and that's what I'm going to talk a bit more about now. So initially, so probably over 2 to 3 years, we worked very hard across Guy's and St Thomas's dialysis units and also King's College Hospital dialysis units, and staff were great. They really engaged with it all. And at the end of that time, almost 10% of the patients that we'd approached had become fully self-caring and were dialysing independently, so we were very pleased. A further 50% were self-caring to some degree, and we felt that we'd increased patient choice, we'd increased access to home haemodialysis, we'd introduced nocturnal home haemodialysis, which was quite new then, and we also had designated self-care areas in some of our satellite dialysis areas. Most importantly, I think we felt that we'd really changed the culture. We'd moved from almost complete dependence to at least partial independence. We'd increased patient involvement. And we also, based on this work, reconfigured our future haemodialysis units to always have an area to support self-care and to always sort of configure the units in bays so that would support teaching. So at that point, our sustainability strategy was to celebrate our successes amongst and share the learning across all of the units. To support leadership, because we found that the key to success was strong, effective, visible leadership and team building. We developed share HD areas in our satellite units, and we tried very importantly to identify clear patient-centred benefits, so more flexibility around appointment times, less waiting, and also if we had a shared care bay, the patients were able to negotiate with each other if they wanted to change their dialysis days, and that worked very, very nicely for those patients. We increased access to home haemodialysis, and I'll talk a bit more about that shortly, and we developed a new pathway for us, which was from shared care to home, rather than just expecting patients to train for home haemodialysis straight away, and that also worked very well. And most importantly, I think we changed the culture, and we sort of introduced a culture of this is the way we do it here. So involvement in care and shared care was seen as normal. So over the next 10 years, outcomes, we had pockets of excellence. We had evidence of shared care in all 6 of our satellite units at Guy's. And we had the home haemodialysis pathway developing nicely, with the majority of patients going home had actually come from the shared care programme. The challenges were staff turnover, because we were always having new staff, and it was to try and sort of introduce them into the shared care ethos. I think our old friend, competing priorities. I think nurses are very busy. We ask a lot of them. We probably ask more of them year on year, and so there's a lot for people to do. We've heard a bit about patient dependency, and I'm sure you will have patients in your units who are elderly, frail, people with early stage dementia, and obviously being involved in care is more challenging for those patients. Demand and capacity continues to be a challenge I'm sure everywhere. And motivation, I think you need to carry on motivating staff, motivating patients throughout the journey. So this is our home hemodialysis program, and you can see here that we peaked there at around, I can't quite read that, 53 patients. And unfortunately, we have dipped a bit. Some of our long-standing home patients sadly passed away, a few others were transplanted, but we're working hard to increase that. And last year, 11 patients went home, and 7 of those were from the Share HD program. So we felt that was very successful. So where are we now? So our aims are the aims of the Share HD collaborative here, and specifically, our aims are for patients to reach their maximum Share HD potential, for patients to feel more involved in their care, and we measure that via our patient experience surveys, which we do every 6 months in our dialysis units, and to challenge the culture, moving from dependence to independence, from passivity to activity, and to continue to increase the take of home therapies for those that want it. Our approach has been to do the baseline measure of the 15 tasks, survey the staff to find out from them what their views are, what they think the drivers are, what they think the barriers could be, present the findings to the staff at a workshop, discuss the drivers and barriers, and encourage them to think about strategies to introduce Share HD, and involve our practice development nurse, involve our home dialysis team to see any patients that might be interested in going home. Importantly, to get buy-in from the whole of the multidisciplinary team, especially the consultants. I think that's really very important for patients. Involvement of our pre-dialysis team, and most importantly, patient champions, peer supporters, and we've also had a lot of support from our Kidney Patients Association. I'm sure you'll all agree that I think it's much more powerful when expert patients talk to patients rather than nurses trying to encourage shared care. Importantly, our strategy has been to encourage the teams to take ownership, to develop their own strategies, and to introduce it in a way that works for them. So a bit more about motivation and ownership. I'm sorry I'm talking fast, but I can see the clock ticking down. We've encouraged ownership by supporting the teams to develop their own strategies in their own areas. One size certainly doesn't fit all. We've also acknowledged that some people need help to develop their confidence and their skills with regards to teaching patients, so hence train the trainers. We've tried to involve the whole of the multidisciplinary team, especially the consultants. I think that's really important to get their buy-in. We tried to strengthen the links between the shared care teams and the home team, using patient feedback and patient stories to motivate other patients and staff. Share successes, celebrate successes. And I think you do need to expect setbacks, but I think it's just important to accept that, don't lose the momentum and just keep going. So these are our satellite units. So New Cross is where we started the share care a couple of years ago. They've got their own, they've got a bay for share care patients, and some of their patients have gone on to home hemo. Camberwell, all patients are doing some shared care, and they've also got a little room separate from the unit where 4 patients dialyse independently. Borough have also got a shared care bay with flexible appointment times, and those patients sort of collaborate with each other if they want to swap days or times. Tunbridge Wells has the home haemodialysis training centre for Kent, and Sidcup also has some of their patients going home, and Lewisham is moving into a new centre in the spring, so we'll pick it up with them when they're settled in there. So our vision, we want to increase access to home dialysis while acknowledging that it's not for everybody. We've just appointed an advanced nurse practitioner to lead that team and bring the haemodialysis and peritoneal teams together and hopefully increase the access to home therapies. We want to have closer liaison between the satellite units and the Share HD team with the home team, and the advanced nurse practitioner will be able to facilitate that. We are continuing with our home dialysis roadshows, kindly sponsored by industry and Kidney Care UK, and they've been very successful. More, I think, just in raising awareness amongst patients and staff. And we're going to train some more peer supporters this year and more patient champions to try and promote involvement in shared care and home dialysis. We're now setting up a new starter area, so we hope to open that in April. And our aims for that are to have a seamless transition from the low clearance clinic, which we call advanced kidney care, to the hemodialysis units. Because feedback from patients in the past has said that they get a lot of education and information in pre-dialysis, but it kind of stops a bit when they start on hemodialysis. And we feel that we'll be able to focus more on education and planning, involving all of the MDT, dietitians, physios, OTs, social workers, psychologists, and the medical team. And we think that will therefore make it easier for us to promote involvement, because they'll be starting off in a new place together, and it's easier, as we've heard, to start off the way that you mean to go on rather than change very long-standing behaviours. So we hope that that'll be a good opportunity to introduce shared care right at the outset. So our vision for patient involvement is for all of our patients to be actively involved in their care as far as possible, and to work in partnership with clinicians to improve their outcomes and experience. And last year we made a series of 4 films. They've just been released just a couple of weeks ago. And so film 1 is living with early stage kidney disease, having dialysis, having kidney transplant, and supporting you to manage your kidney condition. And each film features clinicians, but most importantly, expert patients. And the series of films starts with an introduction by the chair of our KPA, who has been a kidney patient for 40 years. And we've tried to promote within those films shared care, working in partnership, and being involved, taking control. And that's really what underpins the messages in all of those films. And they can be viewed on YouTube or on the Trust website. And those are our contact details. And now I've finished with 3 minutes to spare.
Thank